Hi, I'm Carrie Bruno. I'm a registered nurse, lactation consultant, and certified Menopause Society practitioner. I have dedicated my entire career to maternal child health, and I am here in this corner of the internet because I am in a new phase of life and I see the gaps. So if you are in your late 40s or your late 30s, your 40s, or your 50s, welcome. Welcome here. This is a safe space where I am going to debunk all kinds of garbage and noise that you've probably been told about your own health. As a registered nurse and a part of, the healthcare team, I see the gaps and I've seen it firsthand because I'll tell you a little bit about my story. When I turned 40 years old, I very quickly realized that it was going to be up to me to research what was going on with my own body. All of a sudden, I was getting up multiple times a night, having to pee. I felt like I always had a bladder infection. I don't know if this resonates with you, but what happened is I would go to my family doctor. They would do a urinalysis. They would do a urine culture. Nothing would show up, but they would treat me anyways. I ended up on antibiotics where I would feel better for a short period of time, and very quickly it would return. I think the first year that this was happening, I ended up on antibiotics 8 or 9 times. And my learning is that antibiotics actually do have an anti-inflammatory effect, which is why I felt okay in the beginning. But it wasn't the answer. So then my next step was a referral to a urologist who, after all of the tests, I never had any blood in my urine, but they told me I had interstitial cystitis. I don't know if anybody's heard about that, but essentially that is a diagnosis that happens after everything else has been ruled out. And there's really no treatment. They tell you to avoid caffeine, avoid citrus. And I did that and nothing changed. And so here I was, 40 years old, growing a business, working, and managing my 2 little boys, trying to manage life and having to know where the nearest washroom was, having so much urgency and up all night needing to use the washroom. And I thought, this is not it. I looked into interstitial cystitis. There's tons of Facebook groups, and I thought, no, this is not it. There's something else. And then I realized that there's something called genital urinary syndrome of menopause. And I had turned 40 years old. This actually happened when I was in my 30s. It started when I was 39 years old. And I started doing this research when I was 40. And I realized that the healthcare system had missed the mark with me. I did not have interstitial cystitis. I did not need antibiotics, but in fact, my hormones were starting to change. It was a light bulb moment for me that I had found myself. And so what I realized I needed was vaginal estrogen as well as pelvic floor physiotherapy. And that combination of the two. And so it involved me going back to my healthcare provider with the information needed to advocate for myself and tell her this is what I need. I basically convinced her to let me try. And I did pelvic floor physio. And I can tell you, within 2 months, I felt like myself again. And it was life-changing for me because I realized I wasn't going to have to live in agony, which is what every healthcare provider had basically told me. It was a chronic condition that I was just going to need to get used to, but that there was a solution. And that's why I'm here. That's why I'm starting this channel, because I want you to know if you have some weird symptom, it might not be what I just described, which is urinary symptoms, which are very common, by the way, but I want you to know that there are estrogen receptors all over our body. And how it works is as we move closer to menopause, so how menopause is defined is menopause is actually only one day. It is 12 months without a period. Then you've experienced menopause, and then the rest of your life you are postmenopausal. But perimenopause lasts 7 to 10 years before your last period. The average age of menopause is 51 years old in North America. That means that there is women 45 years old who are experiencing their last period, and that is normal. And they might experience perimenopause, very well could, for 10 years before that. That means you could be 35 and experiencing perimenopause. And I'm telling you right now, we're not talking about this enough as a medical community. And I am here on this corner of the internet to raise awareness. I have grown a team of registered nurses and nurse practitioners who have committed their careers to helping women navigate through the time in our lives of perimenopause and menopause, because I'm telling you, perimenopause is more than hot flashes. And I think that's often, the story that we're told. And it can happen. Your story is going to look different than mine, which is going to look different than hers. But I'm telling you, the fluctuations in your hormones in perimenopause could be causing a lot of your symptoms, whether it's body odor or itching or ringing in your ears or weight gain. All of it deserves to be addressed. And so, welcome. Thank you for listening to this video. Please know that there's more coming. I plan to show up every single week and teach. So if there's something you want to talk about, you can put it in the comments. Let's start the discussion. Check out our website. Send me any questions you have, because I want you to know that you deserve support. You deserve to be cared for. Your symptoms don't deserve to be brushed off. And often it's perimenopause, and there's so much we can do to help you feel your best. So thank you for listening, and I will see you at the next video.